Hey guys, okay, now we'll be talking about the femoral nerve, entire course of the femoral nerve. It is the important nerve for the anterior compartment of the thigh. All the anterior compartment of the thigh is supplied by this femoral nerve. This will be arising from the psoas major muscle. Psoas major muscle and descent actually it emerges from its lateral boundary. When you consider this medial lateral, so it emerges from its lateral boundary. Actually, it is formed by the posterior division of anterior primary rami of L2, L3, L4. Please do remember this is a posterior division or also called the dorsal division, because we also have the same L2, L3, L4. Ventral division is that will be forming the obturator nerve. So that for it is important to note here that it is formed by the posterior or the dorsal division of L2, L3 and L4. Okay, so it arises in the psoas major, emerges from its lateral boundary, descend between the psoas major and iliacus, actually descends between the psoas major and iliacus and enters the thigh behind the inguinal ligament, and it is present lateral to the femoral sheath. So now it has entered. See this L2, L3, L4. This is anterior primary rami of the posterior division. So it has entered the thigh. In the thigh region, after entering 2.5 centimeters below the inguinal ligament, it is divided into anterior division and posterior division. This anterior division will be giving two cutaneous nerves, namely the medial cutaneous nerve, intermediate cutaneous nerve, which supply the center anterior and medial parts or medial skin of the thigh, and also one muscular branch, that is the muscular branch to the sartorius muscle, and this posterior division will be giving four muscular branches to the quadriceps femoris, rectus femoris, vastus lateralis, intermedius, medius, and also to the knee joint and also to the hip joint. It will be giving only one cutaneous nerve, namely the saphenous nerve, which continues down still after the leg, even in the adductor canal. The saphenous nerve will be crossing this femoral artery from lateral to the medial like this. So the saphenous nerve will be providing the infrapatellar branches, supplies the skin near this knee joint, and then also supplies the skin on the medial side of the leg, and also supplies the skin on the medial side of the foot up to the ball of the big toe. Up to the ball of the big toe, the saphenous nerve is supplied. This is the entire course of the femoral nerve. Now coming to the clinical aspect, injury to the femoral nerve is very rare. It usually happens in case of stab injury or the pelvic fractures or by the gunshots. So what happens if there is an injury? It causes a motor loss and sensory loss. Motor losses because see, I told it will be supplying the entire anterior compartment muscles, right? Anterior compartment muscles, what for they perform extension, and there is no flexion also because I'm sorry, there is no flexion also because sartorius and iliacus are also become paralyzed, which performs a flexion. And sensory loss, anterior medial part of the thigh become loss of sensation because they are supplied by intermediate and medial cutaneous nerve, and also medial side of leg and foot. All of this region sensation will be lost. And next, another cause could be a femoral nerve neuropathy. It is compressed by the retroperitoneal tumors. Retroperitoneal tumors causes compression of this femoral nerve, which happens usually in the diabetes mellitus. Diabetes mellitus that lead to weakening of the quadriceps femoris, which will become very difficult to walk. Pain and paresthesia in the anterior and medial side of the thigh. Anterior and medial side of the thigh.